a Mental Health Monday, and with so much trauma and negativity in the world, many of us may be struggling to help our loved ones without adding extra stress in our lives. The people expert, Dr. Sabrina Jackson, is here to help us discuss this now. So, Dr. Sabrina, you can't just be friends together when things are going well.
Exactly.
But at what point do you protect yourself when trying to help somebody who's not in a good space right now?
That's why my acronym is GUARD. You must guard your mental health while still being there for the other person. So the G is that you have gentle encouragement. Don't stuff your values down there. Don't say you should do this way or you should feel this way. No, gentle encouragement. Then utilize active listening. Active listening is huge because sometimes we want to jump in and help, and the person may just really need a listening ear.
Yeah.
They just need to
get it out.
Just get it out and not go down a rabbit hole about it, but just, so we listen for clarity, for understanding, but not a rebuttal.
Okay.
So then you need to ask open-ended questions. Open-ended questions allows the person to be more critical in their thinking about the situation. It helps them to answer the questions for themselves and not you giving them the answer. Because when you feel like you have to give the answer, it puts more pressure on you. Yes. Then you need to respect their perspective because they're the ones actually dealing with it. And so we need to respect it. We can't move them where we want them to be or have them to do what we think they should do. We should respect their perspective. And then this last one is huge.
The D.
The D, because we live in the D. But develop boundaries.
Yeah.
You have to know when to not answer the phone. You have to know when to let it go to voicemail, listen to the message, and then respond. Because you may not even be in a place where you can listen to what's going on.
Right.
You need to make sure you're okay. So setting healthy boundaries is so important for your own mental wellness. I can't pour from an empty cup. It
feels like it's such a needle to thread. You know, a very thin needle to thread when you want to be there for your friend who's going through a tough time, but sometimes you just can't hear that constant negativity for your own well-being. So the boundaries are important.
And it's interesting because I heard someone say that being self-care and selfish is not being selfish, it's helping to make you self-full. I can't give to you when I don't have anything to give.
Right.
So I need to make sure I'm doing the things that I need to do to become able to be a good friend, to be able to be there for you. Sometimes, I remember a good girlfriend of mine lost her husband, and that evening, I got over to her house and I stayed there all night. We didn't talk. We didn't talk at all.
You were there together.
I was just there with her.
You just got an award too.
I did.
How about that? Congratulations.
Thank you
I feel
so
like you
much.
get an award like...
You sound like my son. He says the same thing.
Well, listen, it's great to be recognized for helping people.
It is. And so I received from the African American Leadership Institute. Hey,
how about
Al and Tashana, and they got engaged at the event last night.
Stop it.
So congratulations to them. But they gave me the Judge Deborah Thomas Social Advocate Award, which is huge for me because over 30 years ago, I worked in an office building where her law office was, and when I was expecting, she would come by and rub my belly.
Unbelievable.
Now that belly is 31, okay?
Unbelievable. Well, Dr. Sabrina, thanks for so much, for everything that you do for us and for everybody out there watching. For some people, this is,
It's the little piece of the little
slice of wellness.
Let me get myself together.
A little slice of wellness. You're coming back in the 10 o'clock hour.
Yes.
We're going to discuss, events like Making Strides happen over the weekend. We're going to discuss what community can do for rallying support around somebody going through a tough time.
Absolutely.
So we'll have that. SabrinaJackson.com.
There was a sea of pink parading through Detroit's Corktown neighborhood for a good cause. The annual Making Strides Against Breast Cancer Walk that was this weekend. With our very own Jay Towers and Tara Nasher, there Saturday morning, more than 10,000 people walked to raise money for breast cancer research. Many of the men and women at that walk have been impacted by breast cancer in some way. Perhaps they lost a loved one to the disease or they're survivors themselves. Dr. Sabrina joining us once again to talk about how to come together as a community and tell us about care.
Yes, you must care. We must care, and when we show that we care, it does some things for all of us. Collective healing. That is such a huge thing, because sometimes when we're going through grief or loss or even the challenge, we think that we're all by ourselves.
Dr. Sabrina, break down collective healing.
Collective healing is when we all get together and we do something that helps all of us to feel better, to understand that we're not by ourselves, and to help us to celebrate. Sometimes, you think about that sea, you see celebration, you see smiles, so people are honoring the memory of people that they may have lost to the disease, or we're honoring the people that are still in the fight. And so that collective healing can be celebratory.
Acknowledging awareness.
Absolutely. And so that A is so important, that we spend the time to activate collective mobilization, that we get together, that we do things not just in a silo, but 10,000 people? That's collective mobilization for whatever the topic is. And then the R is that it's resource sharing, and it raises awareness. So when you see the pink, like today I have on pink, I'm wearing pink.
That looks good.
Yes, it helps to raise awareness, because there may be people sitting at home thinking that no one knows what I'm going through. But when you see that it's 10,000 people, you don't feel alone. And you also get to share resources. There may be a resource that can benefit someone that's sitting in a space of grief that they can get from this type of event when we come together as a community. And then lastly, it's just emotional support. We all need it.
Yes,
so
we
when
do.
we come together and we show that we are supporting each other, I may not have experienced it, but I do absolutely know people who have experienced that type of loss. And so, oh my goodness, it is a good time when we come together and just emotionally are there for each other. The donuts, the
cider.
The cider.
Yes.
You know, it's a little chilly, so we're hugging, we're dancing, we're hustling, we're doing all of those things to support each other. And oh my goodness, breast cancer awareness. And there's lots of things that we can do that around. This month is also domestic violence awareness. So when you see the purple, it's really coming together to just make each other be more elevated in our thinking and elevated in our feelings.
How do you help someone who is very locked in, who's very tight for their own reasons, but how do you begin to break through and get them to maybe open up, to show a little bit of emotion?
This is so important to know, because maybe they don't need to open up.
Okay.
Because everybody handles things differently. So whatever a person is sitting in at that moment, it may be just important for them. And we need to support them in their moment and in their space. And just knowing that they're supporting may make them open up.
Just being present.
Just being present. I have sat on the floor with my friends when we're dealing with something and don't say nothing. We're just sitting on the floor.
Sometimes less is more.
Sometimes it absolutely is.
Dr. Sabrina, always a pleasure.
No, the pleasure's mine. Hot Josh.
Oh my God.
Yes.
I will take what I can get, my sister. Marielle, save me, please.
I'll save you, hot land.